Hi everybody, I'm Paul Mears, Chief Executive at Tough Montgomery Health Board, and it's really great to be able to give an introduction to this training on value-based healthcare for our organisation. Value-based healthcare, many of you will know a bit about because it's been around in Wales for a long time, had its origins in the prudent healthcare work a few years ago, which was part of the Healthier Wales policy development. But essentially, how do we deliver better outcomes for our patients, our population, with using the best use of our resources? And it's a really simple concept when you really break it down to that level, but it's a really important concept at a time when the NHS is facing significant pressures in terms of demand, so more and more people wanting and needing services. We know our capacity is constrained by workforce challenges and needing to make best use of our workforce. But equally, we know patients' expectations are rising and people are expecting more of us as an NHS. So it's really even more important than ever that we think really carefully as an organisation about how we embed value-based healthcare principles in what we do. A key part of one of our corporate goals is sustaining our future, and that's about sustaining our future financially, from a workforce perspective, from a clinical perspective, and value-based healthcare is fundamental to all of that. And we've got some great examples already across CTM of where value-based healthcare principles have been used to redesign services to benefit our population. And more often than not, those initiatives have been driven by really motivated and enthused clinicians who've wanted to see better outcomes for their communities and patients and have seen the opportunity of using the value-based healthcare principles to redesign their service, whether that's in terms of some of our drug and alcohol services, whether it's about how we redesign the lung health check program, whether it's some work we've done in cardiology, looking at management of heart failure patients. Lots and lots of different people are already doing this in CTM. And actually, you might even find when you go through this training, you realise you've been actually applying value-based healthcare principles without even realising it. But part of this training is to make sure that people across our organisation understand what value-based healthcare is, how it could be used in redesigning and improving your services for your patients, how we make sure we really get good at collecting good outcomes data for our patients, so using the new tools that we're developing across CTM to gather good outcome data from patients, but also experience data from patients, so we can really marry the clinical outcomes with the patient outcomes and experience, so we can look at those outcomes in the round. So it's really important to us that colleagues across our health board have proper training in this, and this is why we're doing this today. And it's, as I said, a really fundamental part of how we make sure that in the future we can deliver better services for our population, we can make the best use of the resources that we have available to us, both people resources and financial resources, and most importantly, we can deliver better outcomes for our communities, because we know that in our communities in CTM, we have some really challenging health outcomes, some of the worst health outcomes actually anywhere in Wales, if not the UK. So it's really important that as well as providing better care in terms of access and timeliness of care, we focus on how we can deliver better outcomes for the population, whether that's in terms of the outcome for the individual patient in front of you today in the clinic, or indeed the outcomes in the longer term for a whole population of patients across CTM. So really encouraged and pleased that we are working on this in CTM. And I should also say, this isn't just something we're doing here in CTM. This is a programme of work, and value-based healthcare is something that the whole of the NHS in Wales is very much focused on. And the work we do in CTM is networked in with other health organisations across Wales, making sure that we are learning from each other, because in the same way we need to learn within CTM, there's lots to learn also from other colleagues in other parts of Wales who've undertaken initiatives in this space, where we can learn examples and take good examples and apply them in our own organisation. And the opportunity to learn and share together is obviously something we really want to promote across the whole NHS in Wales. So what you're doing today is not just important for you and your patients and the CTM communities, but it can also help inform how this agenda is really translated and shared much more broadly across the whole NHS in Wales. So I hope you enjoyed the training. I hope I'll see lots of people taking the ideas coming out of this training and going back into their services and teams, looking to how they can really think carefully about how you improve outcomes and improve efficiency and value for your service, for your team. And best of luck with it all, and I look forward to hearing more about it. Thanks very much.